Well, first, thanks to everybody for having me out, and really wonderful audience. For some of you who were with us last time in Cincinnati, there are a couple of slides you'll recognize. We'll go from there. So first, we're just going to kind of talk about a few definitions. Some stuff's going to seem pretty obvious, but make sure we're all on the same page, and then we'll figure out what not to do first. Now, this isn't up, I'm not up here blaming anybody, saying you evil parent, you shouldn't have done that, because I'm sure all of you have probably had people do that to you before. Shame on them. Then we're going to talk about what works. Some of it might not seem right at first, but bear with me, we'll figure it out together. And then there is some good news that we'll go over at the end. So, as part of this talk, I have always tried to figure out just how I can talk about EB alone. I can't do that, so I've really had to expand my talk to talk about all chronic illnesses. Why? Because there's very little out there. 2008, when I first started talking about this, there were a whole 6 articles out there. Then in 2010, the same 6 articles were still there. And in 2012, wow, we've done a whole lot more research and we've added 2. Yay. And they were both written in 2010. So that was PubMed. Then I went to another one on Ovid and found a whole 3 articles now. And again, the most recent was in 2010. Google, well, of course you get 5 bazillion hits, but really only 17 in 2008, and 6 had anything to do with EB at all. There were plenty for Viagra and enhancement of other things, but go there. In 2010, I got 116 hits. I quit looking after a while because most of them didn't look at anything. In 2012, this year, again, same thing. So, start off with just coping. What is coping? Well, basically doing something with a stressor, either avoiding it, preventing it from happening in the first place, or just managing it. There's a couple of different ways that you can do that. There's emotion-focused and problem-focused. Now, problem-focused tends to be the better way to do things, but if you can add a little emotion-focused on top of it, it tends to work even better still. So change the situation and change it how you feel about it. And also remember, and this is really important for couples out there, everyone copes differently. As many years as I've been doing this, I have never found 2 parents who are exactly on the same page with coping about anything, let alone treatment. I mean, it could be buying the car, what are we having for dinner tonight, anything. So understand that when your spouse or partner doesn't see eye to eye with you, that's okay, and that's normal. And if you're the only one in the room, I'll agree with you, and if they're, it's just safer for me. Now, what's stress? Well, stress is when the demands outstrip our abilities. When we can't handle something, or when we think we can't handle something, we start to feel stress. Most of us feel it physically. We'll get tired. We'll get, some people will even get sick. You'll also see people get a little more cranky. Actual clinical depression will set in. Clinical anxiety will set in. Anger issues. So a lot of different difficulties with chronic illnesses. There's physical. I mean, this is all, none of this is new to any of you. Physical problems, emotional problems, social, and economic. And economic is often forgotten by a lot of folks. And I see we've got someone tomorrow who's going to help with insurance issues, so that's really a good thing. And so thankfully we'll have some more about that. So for parents, as all of you know, when the diagnosis came down, you learn that you have to build a whole new world around what your child is going to need. Some need more, some need less, but anything that you knew changed. Not necessarily a bad thing, but just changed. Of course, everybody worries about what's going to happen later. Not just tomorrow, later, but you worry about that too, but what's going to happen in 5 years, 10 years, 20 years. And how am I going to ever leave my kid alone? How are they ever going to be able to do it as well as I can? What if they need me? So families tend to do better if everyone collaborates. Now this is true of divorced or separated couples too. Your issues are your own, have them apart. But when it comes to your child, and this is for anybody, both parents, when they're collaborating, the kids do better, the family does better. The parents and child work as a team. Know your child when they're 3 should not have the final say, otherwise no one would ever eat broccoli. But everybody has to work as a team, and the older they get, the more that they can be given. For example, forced choices are a wonderful thing. Do you want to change the dressing on your right arm first or your left arm first? Notice that no arm first is not an option. You give them choices. Choices lead to senses of control, and a sense of control helps make everyone's life go a little more easily. Good communication is a key, and use effective problem-solving skills, and we'll talk about it a little bit later. Better treatment adherence, fewer hospitalizations, fewer needs to call the doctor, and life goes a whole lot easier. Now, sadly, there is no quick and easy way to learn how to cope, and this half-hour talk is not going to be all end-all. But we'll figure some more things out. There is no magic pill. People have asked, and sadly I can't prescribe that. If I could, I would never have to work again. And just because there's an illness doesn't mean the family has to do poorly. Some people will come in with that assumption of life is over. My kid has this diagnosis or that diagnosis, life is over. No, it's not. It's just starting. It's just different from what you expected when you found out that you were pregnant. So let's talk about what doesn't work. There's plenty of that out there. And sometimes the confusing thing about what doesn't work is that it does work for a little while. So what are maladaptive coping skills? Well, those reinforce negative views of yourself, of the situation, of what's going on. People don't do as well who use them. And like I said, sadly, sometimes they work for a little while, and once you get started into that habit, it's almost impossible to stop. How many of you have heard the whole, well, we've been doing it that way for 10 years. Maybe you've heard it from wherever you've been or from family members, whatever. Well, it's the way we've always done it. So, how many have ever, when things are going bad, blamed somebody? Maybe a spouse. I see a lot of finger pointing out there. We all do it. We get cranky, we don't want to put it on ourselves, we got to put it on somebody. You did this to me. Well, no, that one didn't, nobody did, it just is. Avoidance. There's bargaining, there's delaying. Well, okay, what if we change my dressing after this show? Okay, well that show's over, but there's another one I didn't realize was on, and I really want to do it, and we'll change it then. Delaying. Doesn't work. Catastrophizing, blowing things totally out of proportion. Changing the dressing is the worst ever. Anybody ever said that? Yeah. Sure, it might be the worst ever at that moment, but is it truly the worst ever? No, there's much, much worse things than changing your dressing. Not to say that changing your dressing isn't, always easy. Poor anger management. There's a lot of people out there who, before anything was going on, they had poor anger management skills. This doesn't help. You gotta work on it. If you realize or your spouse tells you, keep saying, look, you're angry all the time, you gotta get some help, and you gotta get some help yesterday. Denial. It's not that bad. You gotta be realistic. Projection. Directing your anger towards other people, not good. You get upset, you get angry, don't go slap your spouse or kick the dog. I'll put pets in with the projection too. Displacement, putting anger on something else. Well, that's a whole lot, kicking the chair is a whole lot better than hitting your spouse. Of course, it doesn't do your toe any justice, but if you're gonna do one, do that. But that doesn't help either. Still doesn't fix the problem. And really that's a key thing with all of these maladaptive skills. Is this gonna fix anything? If I go and rant and rave and punch a hole in the wall and scream and stomp and spit and everything else, is that gonna fix this? No. Does the dressing still need to get changed? Yes. Is my hand sore because I put it through the wall? Yes. And I probably need stitches. Acting out, same kind of thing. Is this really gonna help? And really later, does this even make me feel any better? Probably not. Regression, you often see this in kids, especially after they've been in the hospital a long time or they've been really, really sick for a while. But parents see it, or do it sometimes too, behaving like a little kid. You'll see a child who was once totally potty trained, now is having accidents again. Sometimes you'll see this in siblings too, when maybe things aren't going as well at home, or maybe their sibling has been in the hospital for a long time, and now why are we wetting the bed? You were totally fine for a couple of years. It's regression, it'll get better, it can be worked on. Sometimes folks get kind of depressed. If you notice this in yourself or in your spouse, really it's important to start looking for some help. Get somebody to talk to, somebody who will listen. Isolating is never good. Personal fable, you'll see in the imaginary audience, you see this a lot in teens. You see it in teens anyway, but teens who are ill often show this as well. Nobody understands this. No one's like me, nobody gets it. Well, with EB, possibly true. Nobody around you has seen it or hasn't seen it very much. But with normal teenage stuff that everybody goes through, nobody understands what it's like if he doesn't like me. Yeah, we do, we've been there, but it's just different for you. Imaginary audience, everyone's scrutinizing them. No, not necessarily. Putting everything out there it's not anything I can do about it. I can't fix this, I can't do anything, it's outside of my control. There's nothing I can do. Everyone else needs to fix this for me. That magic pill, you have that for me? Because I can't do it without it. So that's what doesn't work. Alright? But what does work? And like I said, most of the time. Trying to actively deal with the problem at hand. Okay, a dressing change isn't going well. Okay, switch locations. Maybe this arm right now at this time is not what's going to work. Let's try the other arm. The first arm's going to get done in a minute. Let's take a break and do this side. What else can be done? Strengthen the view of yourself. Did you do anything to cause this? No. Can you do things to make life better for yourself or your family or anyone else? Absolutely. Keep pointing over there. Build self-esteem. Do anything that you can to really make yourself feel better about yourself. And whether that's taking up a hobby or doing something where you can look back at it and say, well, I did that. Maybe it's planting some seeds in the garden and you watch a flower pop up. Maybe it's, I could just change the dressing myself in this area. Something I can do. All of these things are really associated with resilience and getting yourself better and staying better, and resilience is key to really a lot of good things as far as helping to not have to deal with depression, anxiety, or other problems along those lines. Using multiple skills, getting stuck on one skill and using it alone will sometimes work for a little while, but what happens when it doesn't? And then the time when it doesn't, then all of a sudden you don't have anything because you forgot all the other ones. So use lots of different things at lots of different times. We often learn these adaptive coping skills when we're growing up, but sometimes they need to be taught. Sometimes our parents or their parents didn't have a lot of skills to teach us. Well, where else can we find it? So, social support is a really good protective factor. Those people who can lean on other people, and if you have other people to lean on, they're golden. Now, women do tend to use this much more than men, but guys, go and do this. Go hang out with buddies, find other people, talk to someone. You know, it's a good thing. This, DebRA, I mean, this is huge. Places where you can talk, and if you find someone on a listserv or other media device, Facebook, whatever, and they're not saying things that you want to hear, well then kind of avoid talking with that person for a while. Not to shut them out, but don't lean just on that person. Maybe they're having a bad day. Maybe they're having a bad month. Who knows? But lean on people. It's not a bad thing. Normalization and finding meaning. Maybe there's some personal meaning. A lot of people will turn to religion or spirituality for meaning. And also, how does this work for me? How can I find some meaning in this? Maybe it's I'm doing something to help another person. Maybe this is somehow I'm going to affect someone in a good way. Cognitive reframing. Now, like I said earlier, the negative thinking of, well, this is the worst ever. Well, maybe it's not quite the worst ever. It's not, Sally's disease isn't ruining my whole life. I mean, that's not good. Well, say it like it really is. I'm sad, I'm scared, I'm frustrated, I don't know what's going on, but, most of the time, most days, I'm doing okay. Most of the time, I can manage this. One thing that has always helped me and helped a lot of my patients deal with bad situations at a time is don't focus on the huge picture. Focus on the right now. So can I get through this 2 minutes? You see with the Alcoholics Anonymous literature and stuff, 1 day at a time. Sometimes 1 day at a time is too big. How about 1 minute at a time? 1 second at a time? And whatever you can do to get through that minute. And then, okay, hey, I made it. I did one. Okay, now I did another one. And I did another one. And suddenly, everything's done, everything's taken care of, and hey, you made it. And then the next time, hey, I made it through the last one, I can make it through this one too. And then it gets easier and easier. Yes, there are going to be hard days, but even with the really hard ones, hey, I made it through all those other ones. This one I can do too. Education. Talk with your team. You've heard this over and over again today. Talk with your team. If they're not listening, make them listen. Talk. Use humor, use exercise, and really use hope. Hope for, today will be a better day. If you assume that today's going to be a terrible day, I promise you it will be. But if you assume today's going to be a good day, well, it stands a much better chance to be one. Promote independence. Really get yourself, your family members, everybody to really be as independent as possible. And if you only hear one thing today, it's this. You're no good to anybody else if you're no good to yourself. And I'm not saying be out there being selfish and anything like that. But no, take time. Take time to take care of yourself. Take time to go and do something. Now, for all parents out here, put your hands up. Okay. How many of you have been out with your spouse in the past year? Good. That's more than I usually see. How many of you have been out with your spouse in the last month? Good. Do that. Go out. It could be just a walk around the block. Don't talk about anything, don't talk about EB, don't talk about anything other than, hey, look, a squirrel. Shiny. Whatever, it doesn't matter. Just be. Remember why you two got together in the first place. Go out there. Take a minute. If it's just you, fine. Wait till the kids go to bed. Take a bubble bath. Do whatever. Anything. I know that's cliche, but do something. Anything. So, decision making and being a really active participant in that, not just at home, but also when you're at the doctor's office. How can you, how can your child, how can everybody else take care of things? Do we want to pursue this new treatment? Do we want to try that out? How can we time things differently? Are there certain medications that you might have to take that make you sleepy? Well, can it be given at nighttime? Does it always have to be given in the morning? Ask. Active involvement in care. Having your child, having yourself, really helping out with medications, changing, how the order of things are going to go. How is this going to look? And for the little ones, little ones, having them be your special helper as much as they're able to do. It's amazing what little kids will do for just being a special helper. It's like, hey, can you be my special helper and like run all the way to the neighbor's house, like 6 blocks down, and I'll give you a sticker. Acceptance. And I know this is hard, and I know this is kind of the last step for a lot of folks, but acceptance. See who you really are. This is a life you have, this is the hand you're dealt. And let's accept who we are, and we'll go through there and accept the reality of whatever illness, whatever thing that you have going on. Active and purposeful problem solving is key. Positive self-talk. I kind of covered this a minute ago, but I can do this. I've done it before, I can do it again. And that it's okay to feel sad or mad sometimes. It really is. Guys, you too. It's okay to be sad. It's okay to cry. Compensation, how can you do a workaround? Okay, I can't do this, but what can I do to get the same job done? It might take a few minutes longer, it might take a little bit, but how can it be done? Distraction works pretty well. We talked about that earlier. Relaxation exercises, I think you heard about that as well a little bit earlier. Being future oriented. We're going to make it this long. I'm not going to worry about beyond that. I'm going to make it till graduation. I'm going to make it till the wedding. I'm going to make it till this, till that. Set goals. I can make things happen. I can control my life, and I can control my destiny. Share responsibilities. And this is a really great opportunity here. Talk to others about the disease that you have, and about what you're facing, and learn from each other how to talk to other people out there who ask some really weird, funky, ignorant questions. How do you handle that stuff? And how do you handle on a day when you're not feeling so good or you're kind of upset? Take charge. Not dwell on the illness, because there's a whole lot more out there that you can dwell on that's a whole lot more fun. And the disease doesn't define the person. It's just a part of your life. You're not EB Billy. You're Billy who happens to have EB, who also does this, that, and the other thing. Is funny and active in school and a great participant in class and earning great grades and all these other good things. Oh yeah, by the way, there's that EB thing, but whatever. Protective factor of families. If families aren't doing well before an illness, they don't tend to do well after an illness. But if a family pulls together beforehand, they can pull together afterwards. It's a little harder, but it can be done. And I know I'm running out of time, but there is good news. First few months after diagnosis of any chronic illness is the worst. Yes, there are difficult times after that, absolutely. But the first few months are the worst. It does tend to get better. Most families are resilient, and as you see amongst yourselves here, you're not alone.